those who are into it. It's called the sweetbreads, but it's down in the abdomen, and what it does, it produces insulin. So when we eat or are taking in any sugar, it helps move the sugar into the cells. And the problem comes...
Which is necessary.
Which is necessary. Yeah. All the cells except for 3. It isn't required for the brain or muscles and the white cells. But the rest of the body, it needs it in order to get the sugar out of the blood. And if there isn't enough insulin, and that's the word I will use, enough insulin, then the sugar goes up. And is that important? Yes, because then it causes all sorts of damage. It can destroy the kidneys, and it works with hypertension, arteriosclerosis, hardening of the arteries, strokes, heart attacks, things like that. So what's the type of diabetes? There's 2 types. We call it type 1, which is also known as insulin dependent. And that's where the pancreas is not producing any insulin. Mm-hmm. And those, you have to take shots. There's no other way of getting around it.
Which is a daily?
Which is daily or 4 times a day.
Oh, okay.
Because when you eat, you've got to take something to match what you're eating. So a person who's truly insulin dependent, the shots can be up to 4 times a day if you want good control. Mm-hmm. The better the control, less complications from the diabetes. The type 2, which is much more common, and that's the one that's related to weight, is essentially the pancreas is overworking. It can't keep up with the body's requirements for the insulin. And you can, easy way to think about it is the pancreas can only produce so much insulin, and the body as it gets bigger requires more and more. Can't keep up with it. And so what happens is years before you even have the diabetes, you're running out of the pancreas is starting to wear out. And when it finally can't keep up, the blood sugar goes up. And when it goes above, again, magic numbers, but right now it's 110 on a fasting, meaning when you haven't had anything to eat for about 6 hours, or 200 after eating, we consider that to be type 2 diabetes. And that's one of the ways that we diagnose it. And that needs to be treated. Again, it's one of those interesting things, and you can almost think about it how it works. It needs more insulin. You can't keep up with it. Well, if we can cut down the amount of body, we cut down the amount of needed, pancreas now can take a breather. Mm-hmm. You know, it's not overworking itself and wearing out. And that's why we really push diet, even with the pills, to keep it under control.
Yep, you talked, well, I wanted to get to, we hear in diabetes about childhood onset. Mm-hmm. So there is no age limit for diabetes necessarily.
No. You know, originally it used to be called childhood diabetes was type 1 because that was the only kind that you saw in childhood, which was the person who had either a viral illness or a family history and developed the diabetes that because the pancreas stopped working. Now, childhood onset of diabetes, we're seeing much more and more because the pancreas is wearing out at younger ages, partly because of this stress, if you will, from our good American diet,
sure,
which gets us into trouble. Everything tastes too good.
And they come in huge portions.
Oh, that they do. You know, everything.
Yeah,
everything's supersized.
All right. You talked about the conditions brought on by diabetes, which are numerous. Mm-hmm. Talk about those. What can happen to a person if they leave it untreated, or even if it is treated, I suppose?
Well, it's the most common cause for a person going on renal dialysis. And if you think about it, that's about the worst thing you want to have to go on because it really limits anything you can do. But damage to the kidneys also increases the rate of heart disease, peripheral vascular problems, where the circulation going to the legs starts to become impaired to the point where it's very easy to get infections and hard to fight them, and a major cause for people having amputations because of infections that can't be cured because the circulation isn't good enough. In addition, it also causes damage to the nerves going out to the body, such as the legs, so you can't feel them, and they get numb. What's called diabetic neuropathy. And when that happens, now you have bad circulation and you can't feel something, you can have an injury. And in fact, I will tell you a story. I have a gentleman that we ended up coming for an exam, no complaint, ended up having a tack in the bottom of his foot and had an infection from it. Didn't even know it was there because he couldn't feel it. Mm-hmm. And so it becomes all important, especially when you lose that, to keep an eye on these things. But the best thing is to prevent it. And the best way to prevent it is get that diabetes under control, because then you cut down that problems. And then the other 2 things is stroke and heart disease. And there it's in combination with blood pressure. And that's part of the thing when you're talking why internal medicine, why do we enjoy it? Doing it is working with patients is because a lot of people come in with both.
Sure.
cause, and so you have to treat both. Treating the diabetes and ignoring the hypertension is halfway treating somebody, because you're still going to have an increased incidence of problems. And in fact, a person who's diabetic, we want that blood pressure even lower than we will accept in somebody without diabetes, because it's just like the two together are twice as bad as each one separately.
Sure, sure. Well, we're running out of time, Dr. McMahon. Internal medicine at Pickaway Health Services. Did you want to mention something? You mentioned heart disease. Did you want to say something about cholesterol?
Well, that's the part of this we call syndrome, but the combination of everything is just like with the diabetes, out of control. But even without that, in our diet, a lot of problems with the cholesterol, and that's the third part, if you will, of the things that we need to do to keep heart disease down. Is making sure that we have as much good cholesterol and as little bad cholesterol as you can get. And the only way to check that again is the blood test. And again, whether you do it at a screening fair, but getting it done, and then talking with somebody to make sure that you know what the numbers
Understand
mean is all important.
Yeah, yeah. Again, we're talking with Dr. David McMahon, internal medicine with Pickaway Health Services. His offices are at 6024 Hoover Road in Grove City. You can call, and you are accepting new patients, which is not what we see a whole lot anymore. You can give his office a call at 614-871-3121 for the Pickaway Health Services offices in Grove City. So again, thank you to Dr. David McMahon, and I'm John for CGTV5. We'll see you next month on Burger Beat. Thanks.